Hello and welcome to the Medical College of Wisconsin's Coffee Conversations with Scientists. I'm your host, Raina Andrews. And for those of you tuning in for the first time, let me introduce myself. I'm a mother, a children's book author, a public health advocate, a TEDx speaker, and an engaged community member. And since 2021, we have been sharing the science behind today's most important health topics. Coffee Conversations is brought to you by the Advancing a Healthier Wisconsin Endowment, which is a statewide nonprofit working to improve health and advance health equity in Wisconsin. Now, today we're addressing a very important and deeply concerning issue. Did you know that each year an estimated 300,000 American youth are at risk of becoming victims of sex trafficking? Yeah. According to the National Center for Missing and Exploited Children, this alarming statistic truly underscores the urgent need for increased awareness and intervention efforts. And so that's why I'm glad that today, for today's coffee break, we're joined by Dr. Angela Rabbitt, a child abuse pediatrician at Children's Wisconsin and a professor in the Department of Child Advocacy and Protection at the Medical College of Wisconsin. Dr. Rabbitt will really break down and help us understand the systemic changes necessary to detect, prevent, and treat youth affected by sex trafficking. So let's give a warm welcome to our guest, Dr. Rabbitt.
Thanks, Raina. It's great to be here.
Absolutely. And so for those of you out in the interwebs, we have a very important topic to discuss, as I just shared. So while we have a packed agenda for this brief coffee break, we encourage you to participate by noting your questions in the chat function of our live stream. We will address as many as possible during this short coffee break. So let's jump into it, okay? So I have been in this space for a very long time, Dr. Rabb, and have been aware and privy to what human trafficking is, what sex trafficking is. But can you, just to level the playing field for those that this is a new concept for, can you help us define what human trafficking is?
Sure. In Wisconsin, child sex trafficking is when a person less than 18 years of age performs a sexual act in exchange for anything of value. So the definition for adults and kids is a little bit different. For adults, the definition requires that the trafficker uses force, fraud, or coercion to get the victim to perform the sexual act. But that's not the case for youth. For youth, they're not legally capable of consenting to sexual contact with adults. So coercion is implied. So for a child, anytime a sexual act is performed in exchange for anything of value, that's sex trafficking. And that
So
it's important to recognize too that law does vary by state, and that's the Wisconsin definition.
that's mind-boggling how you have to define this because a child is so vulnerable. When you think about how they're developing mentally and physically, how could a child ever consent to uh, it's awful that we have to talk about this, but from a state of awareness, I think people need to know about this invisible crime happening in our backyard and right in our face. So to really get people to understand how much of an issue this is, can you provide an overview of the current landscape of child sex trafficking um, across the United States, in Wisconsin? How does that compare globally? Where do we stand?
Yeah, I can try. Unfortunately, we don't have a very accurate estimate of the number of victims out there because it's such a hidden crime. Victims are often ashamed or afraid to say what's happening to them. Some, especially youth, don't really know what trafficking is. And so they don't associate what's happening to them as trafficking, and they're not going to come out and tell you that they're being trafficked. And then even among professionals, there are a lot of different levels of understanding. So even if a child presents to law enforcement or child protective services or any other professional, and they clearly meet the definition of trafficking, they might not be recognized as a child who's being trafficked. And then on top of that, there's not a really great uniform global database of victims. So it's difficult. And anytime we talk about numbers, I think it's important to know that they're probably underestimates of the total out there. But I can give you some data based on the best information that we have. And I will share my screen. Okay. So Many use the data from a global standpoint, based on the United Nations Global Trafficking in Persons Report, or the TIP report. In this first slide, you can see some of the numbers. The TIP report is really the largest existing global data set. It contains data on 141 countries. According to that most recent report, as of 2022, the rate of human trafficking was 1 out of 100,000 people in participating countries. So for every 100,000 people out there, one of them is being trafficked at any point in time. There are many forms of human trafficking, as you can see on the diagram on the left, but about 39% involves trafficking for sexual exploitation or sex trafficking. 35% of those are children. So globally, there's a pretty high number of children.
Yeah, that's alarming.
Interestingly, the rate of human trafficking has been increasing steadily since 2003. But in 2020, it dropped for the first time, and people think that's likely related to the pandemic.
Mm-hmm. So when we think about the United States, how do these numbers compare?
Hold on, I'm trying to get my... I'm going to stop sharing for a second so I can get my slides to go.
You know what I'm thinking about as you're pulling this up, what it makes me think about is the fact that we don't have a consistent definition on what we mean by sex trafficking or youth sex trafficking makes me think, how are we going to combat this as a nation? And it makes me think that the definition is directly connected to the penalty for said crime.
Sorry about that. Here,
And so
we'll
if you're
do this.
challenged to bring it up, we can just reference the slides on your screen that you can see. And I remember during our overview of this conversation that in the United States, yep, you can just keep them up just like that.
There we go.
Mm-hmm.
Okay, so on the second slide, this shows some data from North America. And in North America, things are a little bit different. The rate is higher here, 2.76 per 100,000. It's actually quite a bit higher.
Wow.
And it continued to increase despite the pandemic in North America. We have a higher rate of domestic trafficking, 66%. So that means that the victims were not brought here from other countries to be sold. There's a myth that trafficking usually involves movement of a child across national borders, but in reality, in the US, most victims are born here, they're recruited here, and they're being sold within our borders. We also have a much higher rate of sex trafficking, 73% of the total, and the number of youth is about the same, 30%.
Wow. So what factors contribute to the high risk? Like what does it look like here in Wisconsin?
Well, we have some data about Wisconsin. We have some estimates of the prevalence through the Department of Children and Families.
Mm-hmm.
In 2015, there was a federal law that added child sex trafficking as a form of child abuse. And so in 2017, the Department of Children and Families launched a training program for all child welfare agencies throughout the state and started collecting data about victims, youth victims. In 2021, according to their data, there were 445 allegations of child sex trafficking across the state, and about 83 of those were substantiated. Only 35% of those actually came from Milwaukee. So that is really, it just shows you that it happens all across the state, not just in cities. This map here is from the National Human Trafficking Hotline. So these are calls that came into the hotline from either victims looking for help or people trying to help victims. And you can see that it's true that many are seen in bigger cities and across the coast, but it really happens in every state. In Wisconsin, we see the majority of the traffic happening along our eastern border, sort of from Chicago up through Milwaukee and into Green Bay. But according to data from the Department of Justice, it occurs in every county of Wisconsin.
All 72 counties have had an incident, a reported incident of sex trafficking.
Yes.
My goodness. Thank you, Dr. Rabbit, for taking us through and really leveling the playing field so people get an understand of what it is, the prevalence. And I'm curious now, what factors contribute to the high risk of Wisconsin youth becoming victims of sex trafficking? And how have these factors evolved over the years?
Really, these are the same factors that contribute to the risk in other areas too, in other states across the US. And they've remained pretty consistent over time, I think.
Mhm.
So we looked at this a little bit in our population of youth that we were seeing in Children's Wisconsin who are being trafficked. We specifically looked at things like mental health, prior experiences with child welfare, other demographics like that. We found that in terms of the mental health aspect, 90% of them had at least one mental health disorder. 70% had 2 to 5 mental health diagnoses, and 11% had 6 to 9. So, and these are things like depression, anxiety, post-traumatic stress disorder. And
I was going
those
to ask that.
numbers, yeah, they were significantly higher than even other high-risk groups of youth. And that might be the result of the trauma that they're experiencing while being trafficked. But I think in many cases, that's a pre-existing risk factor that makes them vulnerable to traffickers in the first place. So in thinking about prevention, that's one group we could really pay attention to and keep an eye on and try to help for prevention of trafficking.
Absolutely. But what this also makes me think of is with children going to school all the time. I'm just wondering, what role do schools and community organizations play in raising awareness and preventing sex child trafficking? Is there some type of seminar or webinar or training that people have to go through? What role do they play?
Well, schools and community organizations really play a critical role in identification. They have often the most contact with children and a lot of opportunities to identify and seek help for those youth. Healthcare providers, it's the same. A healthcare provider might be the only contact that a child has away from their trafficker where they can talk to someone who can help them. So I think the most important thing community organizations can do, especially if they work with high-risk youth, is to make sure the staff are educated about definitions and risk factors associated with trafficking and how to respond when they have concerns.
Mhm.
Any professional who is a mandated reporter in Wisconsin is required to report concerns for sex trafficking, either to law enforcement and child protective services. So that is an important responsibility that providers in Wisconsin should be aware of. And then I think also community agencies play a major role to help youth who are at risk for trafficking to decrease vulnerabilities to traffickers and help them find other options when they're in trouble so they don't have to go to a trafficker
Mhm.
to meet those basic needs. And that's really one of the major risk factors for trafficking is homelessness or runaway behaviors where the youth is on the street, they don't know where to go, they don't feel that they have any other options. And then they meet someone who says that they can help them and get kind of pulled into this life in the sex trade.
I'm my heart goes out that the fact that any youth is experiencing homelessness and is vulnerable to the life that exists on the streets. And it just makes me think how we have to get it together in terms of how we define this and how we truly protect our children so that they are seen as victims and not as culprits or someone or as if it's something that they did to attract or cause this themselves. And it makes me think from the work that you've been doing over the years, Dr. Rabbit, you've been doing this for a very long time as a practitioner, and there's some very interesting work that's coming together now through some funding granted through the Advancing a Healthier Wisconsin Endowment. And I'm just wondering, from your perspective, from your vantage, what systemic changes are necessary at the national and local levels to truly improve the detection of youth sex traffic victims?
Well, if we're talking about improving the detection of youth, I think the primary systemic changes needed would be increased awareness of the the risk factors like we had talked about, but also how do you talk to youth in a way that encourages disclosure so that you know that they need help. And we have a great example within the medical systems in Milwaukee. 10 years ago at Children's Wisconsin, we would see maybe one or two youth who had been trafficked every year. And they would come in usually with law enforcement to our emergency department, and they would be referred to as child prostitutes. And that's kind of how everyone thought
Wow.
of them back then. There,
Child prostitutes?
yeah, there wasn't any training in medical schools about trafficking, and probably not in law enforcement or other professional organizations either. But as I mentioned before, federal and state laws had started to change around that time, and we were seeing more youth brought to Children's Wisconsin with concerns for sex trafficking. But none of us, in terms of the healthcare providers, we didn't really know what that was or how to respond at the time. As I said, there was no training and very few community resources. So we educated ourselves. We attended some Department of Justice trainings. We learned more about how to identify victims and address their healthcare needs. And then in 2014, we initiated routine screening in some of our really high-risk clinics. That year, we identified 10 to 12 youth per month on average who disclosed to us that they had been trafficked. In my clinic that sees foster care youth, 11% of youth that were screened positive. And we were just blown away by those numbers. So
Wow. That
those were clinics.
uniformity. Absolutely.
Yeah, I mean, those were clinics that were seeing high-risk youth. So those numbers are not going to be found in a lot of other clinics. But I think the important thing about that we learned was when we educated ourselves and took time to ask the questions, the youth told us what was happening to them, and then we could help them.
So, speaking their language, sensitivity, and having uniformity has made a world of difference. And I mean, you're doing your work in healthcare as a physician, as a pediatrician, and then you have folks in the social services sector, and then you have community-based organizations, schools, you have law enforcement. What's being done to bring you all together to speak that same language?
Well, there are a lot of trainings available. I think Wisconsin really has done a lot in the last 10 years to
Mhm.
try to solidify the response, especially around the response to youth who've been trafficked. I mentioned some law changes that occurred around 2015, and then some changes within child welfare in 2017. And that led to the Department of Children and Families initiating some funding for a regional hub system throughout the state. And that uh, there are still contact points for those regional hubs that are kind of the experts in their region,
Mhm.
where law enforcement, child protective services, other community agencies can contact that person and get information about local initiatives, where to go if they need resources, where to go if they need education. So that's one thing.
Mhm.
In Milwaukee specifically, we've really done a lot of work with our multidisciplinary team, which is child protective services, law enforcement, medical providers, the agencies that serve youth. We created a process. Whenever a child is screened in by child welfare for trafficking, there's a coordinator that's notified that reaches out to all of the different agencies involved with that youth to coordinate things early in the investigation, and also to help coordinate advocacy for that child and resources for the child and for the family that's probably really struggling with this.
Mhm. You know, you've shared a lot about how you're detecting it, and it makes me think with domestically here in the United States, with nearly triple the number of persons being trafficked and a really large amount being children. I'm wondering what best practices have been identified for the treatment and rehabilitation of youth who have been victims of sex trafficking.
Yeah, I think it's a great question. And there have been a lot of studies and research kind of trying to figure out what's the best way to approach youth who are trafficked to really help them. I think they really all point to some key areas. One is professionals working with victims really need to have a needs-focused approach. For many youth who are trafficked, they first enter the sex trade as a way to meet basic needs while on the street. And traffickers take advantage of those vulnerabilities and use those needs as a way to coerce youth into commercial sex acts. They might provide for some of those needs, but then the expectation is that the youth sells themselves in repayment. So for youth who are trafficked, the trafficking itself from their perspective often is not the only or the most important problem that they're facing.
Wow.
So for us to prevent trafficking, we have to find a way to help them, that youth, to meet their basic needs for shelter, love, food, safety, acceptance away from the trafficker. That's one thing. Building trust is really, really important as well. And so going along with that, approaching them non-judgmentally and with a needs-focused approach, so they know you really are trying to help them. You're not judging them, because they're not going to talk to you if they feel that from you.
That's a really, really important point that you make. And we have some comments and some questions from the audience here. So I want to turn to the audience. And one of our audience members would like to know, what steps should parents take if they observe actions or behaviors that raise concern, specifically trafficked children in their community? Like, what should they look out for?
Mm. So there are some things that you might notice for a youth who's being trafficked. Uh, Parents will sometimes come and tell us that all of a sudden their child has money or multiple cell phones or expensive clothing, and they don't really have any source of income for that. That's one thing you can think about. Um, Monitoring their social media use, I think, is really important for parents to do, because that is where the bulk of this is happening. At least the initiation of the recruitment happens on social media.
Hmm.
So being aware of that and monitoring your child's social media content. Um, Youth with mental health disorders are at higher risk. Youth that are running away a lot are at higher risk. And, just keeping the lines of communication open for them, and using some of those same tactics, the non-judgmental, trying to help them figure out how to meet their needs away from traffickers as a way to prevent or respond.
Mhm. That's really helpful. And I think that goes back to parents paying attention to their children. And as social media can be a huge distraction for children, it's become a huge distraction for parents. I know as a parent myself, sometimes I'll be checking messages or texting or emailing when we've got to spend as much, if not more, time with our children than we spend online. And I think this next question really speaks to the treatment of our children as well. And someone here is asking, given the likely long-term effects of sex trafficking on young victims, how do medical providers and health advocates ensure ongoing support beyond just initial interventions?
That's a great question, and it can be really challenging. It was more challenging in the past when there were fewer resources available to youth. Um, Child Protective Services is a way to initiate services for youth. They have also connections to. There are programs out there that will provide advocacy, long-term advocacy for youth. Um, and it's a matter of locating those in your local area. So I had provided some contact information that's on the Department of Children and Families website,
Mhm.
that is contact information for some of those regional hub coordinators that I mentioned before. And so wherever you are in the state, you can contact one of those. They can help you locate community resources that might help provide longer term peer support, advocacy for that child who's experiencing problems.
Absolutely. And we'll put that in the chat right now. Thank you for that, Dr. Rabbit. This brings up a really good point that I've been thinking all along, which is, we've come a long way, but it sounds like there's a longer road ahead. And it makes me think, what are the most critical areas for future research and policy development in Wisconsin to better protect youth from sex trafficking? Maybe less of the policy development, but like, what don't we know that we probably should start gathering data on?
Well, I think the most important thing we need to work on is getting a better handle on the numbers that are out there and the characteristics of those youth to inform prevention activities. In 2019, there was a a study conducted by the Department of Justice looking at law enforcement agencies and how comfortable they felt identifying youth who are trafficked and how often they're getting those into a database, a law enforcement database, so we could track the numbers in Wisconsin. And from that study, they learned that there was a lot of training needed about the definitions, still the definitions of trafficking for adults versus for youth, and more uniformity in how those are being entered into that database. So that's one thing that law enforcement is working on. And I know the Department of Children and Families is continuously working on building their database as well, so we can use that information to build prevention programs.
Mhm. So those are good administrative social safety net structures of what can be done and what's needed. That brings me to the point of we have viewers from all across the country on the internet. I'd even argue globally watching the show. And I'm wondering, how can Wisconsin residents get involved in combating child sex trafficking? And we have a question from the audience where there's a woman who says that she is a school nurse, could be a male or female, that's a school nurse, and they facilitate a rural school nurse program with about 40 other nurses. And they're inquiring, is there a resource that they could use to share or present that could help them know what to watch for and how to respond? So now we're looking at resources that are available.
Uh, there are a few resources I can talk about, and I think I had given some resources for educational materials that I think will be made available. Also, we have a program we started for healthcare specifically. It's called the Healthcare Collaborative Against Sex Trafficking, or HCAST for short. This was a project started by Dr. Wendy Ehrman and I. Dr. Ehrman is an adolescent medicine specialist. We started this project to try to bring together community organizations, healthcare organizations, and survivors of trafficking to create some educational materials that were really informed by survivors, some protocol guidance. So if you are in a situation where you're in a healthcare facility and you need some guidelines on how to create a response for trafficking, we worked on that. And then also some connections with community organizations, between healthcare and community organizations.
Mm-hmm.
That all of that information is on our website, which I think will be in the chat.
Mm-hmm.
There are also, go ahead.
We're putting it right now. So it's
Okay.
hcasmilw.org. Do you want to talk about some of the other resources, or do you want me to cover it?
Yeah, I can talk about that. There are also many community agencies and task forces working to improve responses throughout Wisconsin, and residents can be involved in those if you want to learn more about what's happening locally and meet people who are interested in the same thing. For example, the Milwaukee Anti-Human Trafficking Task Force of Greater Milwaukee. That's a task force that's open to the public, and they've been very active in creating awareness initiatives and supporting legislative changes around trafficking. If you would like more information about various initiatives throughout the state, those task forces, take a look at that Department of Children and Families website. If you're looking for education, in addition to the HCAST website, there's a organization for healthcare providers called HEAL, Healthcare Education Advocacy and Linkage. That is a national organization working to improve the healthcare response, and they have a lot of educational materials and resources on that website. And then finally, the SOAR online trainings are really great for healthcare providers and also a few other disciplines. Those were created by the Office of Trafficking in Persons and the National Human Trafficking Training Center and Technical Assistance Center. For more general trainings for people outside of healthcare, there are some great resources on the Polaris Project website and the National Human Trafficking Hotline websites.
Wow. And with that, I want to thank you, Dr. Rabbitt, for joining us today. I know we were able to cover quite a bit in a very short coffee break, but I just want you to know that I really appreciate you taking the time to talk with us. I know you're very busy, and this is just a really important topic that people need to know about, because the more we know, the better we can do. So thank you.
Thank you.
Yes. And for those of you out there, if we didn't get to your question, feel free to send me a note at conversations@mcw.edu. I hope you all will join us next month for virtual coffee break and a conversation with the scientists. Thank you. Bye-bye.